in a cash for kidney racket in which impoverished people from Myanmar are lured to sell their kidneys for profit. An investigation carried out by the UK's Telegraph newspaper has now revealed. The report says that poor young villagers from Myanmar are being flown into Apollo's Delhi hospital and paid to donate their kidneys to rich patients. The racket involves, and I quote, elaborate forging of identity documents and staging of family photographs to present donors as the relatives of the would-be patients. The report notes that the multi-billion-dollar hospital chain with facilities across Asia conducts more than 1,200 transplants in a year, with wealthy patients arriving for operations from all over the world, including the UK. The Indian Health Ministry has taken a note of the allegations. News9 has spoken to the National Organ and Tissue Transplantation Organization, which has written now a letter to the Delhi government and has asked the Delhi government to initiate an inquiry in the matter. The hospital has denied all the allegations vehemently and has said that they are totally and absolutely false, ill-informed and misleading. We will be reading out an official statement that we've received from the company. Joining me in the studio are Krishnakumar and Kartik Malhotra. Gentlemen, very good afternoon. A very, very serious investigation pointing out at a for-profit kidney sale, poor people from villages in Myanmar being flown into India in violation of the law of the land, asked to donate kidneys for rich people.
Right. So, go ahead, Chris.
Right. I mean, and also the good or the more clear thing about the reportage is that you have the final numbers of how much the whole thing costs. It's 1,79,000 rupees or so, out of which about 70 to 80,000 rupees alone goes to that donor who's been sourced. And in fact, there was clear family trees or fabricated family trees being made to connect the person receiving the transplant to the donor, who's an unsuspecting person who's just in need of cash at the end of the day. The only question I had was that whether it was voluntary from their end or not, because that is one angle to look at it. But the fact of the matter is that this is an elaborate racket of a situation, because there are now, in this case, there's a people like IAS officers involved in the final committee that approves this transplant. And this is a hospital, we're talking about Apollo Hospitals, established in Delhi, one of the first 3 multi-speciality hospitals that Apollo had in the country, established in association with the Delhi government. So in that sense, to find a cash for kidneys, a racket, in an institution like this itself is quite shocking, isn't it, Kartik?
Very shocking. And it's not just about Apollo, Kartik, is it? It's about the larger racket. I mean, you go through the Telegraph investigation where the reporter posed as somebody who is in need for a kidney, goes to the hospital, is then directed to an agent who's an intermediary between the hospital and the people who are in need for kidney, forging these documents.
So, Shweta, I think for us sitting here right now to independently verify any of this is absolutely not possible. And whatever efforts we have made, we've received pretty much the same statements, which are right now there in public domain, where Apollo is vehemently denying these allegations. But going back to the report that Krishna and you were both referring to, I think one thing is definitely very worrying. And that is that you go to a hospital as a patient, real or fake notwithstanding, you go as a patient to a hospital and there is a full-fledged machinery apparently, allegedly at play, where there are agents who are not just drawing up your family trees and showing these fabricated relationships. They are in fact taking the donor and the recipient or prospective recipient and getting them photographed in various locations like holidays, a holiday at a beach, a holiday in a hilly terrain.
So just how elaborate the planning
Absolutely.
is.
So I think it's a fairly deep-rooted racket. If it is on, it is a fairly deep-rooted one. And you're actually convincing a set of doctors who are sitting on the committee, and that committee also has a representative from the health department of the state. So you're not just looking at fooling, and I'm using fooling, assuming that there is no truth to this investigation. But you're not just fooling a panel of doctors, but also a government representative who's sitting on the panel. Now, where does this problem actually emanate from? I think the cause, the real root of this problem lies in the fact that India has very few donors. In 1994,
and very strict rules.
And very strict rules, right. So in 1994, that's the first time that actually a sort of bill was passed and a regulation was passed in India that to receive an organ, you've got to establish a family connection. Anybody outside of the family cannot legally lend out or donate a particular body organ to somebody you're not related to. So I think this very, very stringent requirement legally for a recipient to receive an organ is something which is letting such operations flourish, if at all they are flourishing. Again, that disclaimer. Now, there are two ways to my mind to look at this. Right now, India has got an opt-in program. Now, statistics are also quite telling. In India, you've got only 1 in 1 million people who are actually willing to donate their organs upon their death. So India has got an opt-in facility. If you want to donate at the time of your death, your kidney or your liver or your eyes or any of your organs or tissues for somebody else to benefit from, you've got to do that lengthy paperwork and sign documents and forms and present them to hospitals, and then upon your death can actually those organs be used for somebody else. As opposed to, let's say, a country like Germany, which has got an opt-out facility, which means that when you're born, you are already, as a citizen of the country, committed to donate your organs at the time of your death. And only if you sign those lengthy documentation while you're alive and opt out of that facility, can your organs not be donated to anybody. And I think that is a kind of larger debate that India has to really look at right now, because organ transplantation is obviously a big industry. It's a big requirement more than an industry. And there are people who are fighting for their lives, who need those organs, and imagine the desperation and the lengths at which people are allegedly willing to go to get a poor migrant or a poor laborer from a neighboring country and establish these family trees and get pictures clicked together and convince a panel just to stay alive.
Right. And in fact, to add to that, we're talking about organ donation. Look at the levels of blood donation that takes place in this country, despite the fact that enough and more information is out there for people to let them know that there is absolutely no issues in you doing enough blood donation. Our blood banks are still not running at full capacity in this country.
Absolutely, fair point. I think also time to relook at perhaps the laws around organ donation and for people to be more aware around organ donation. I'm going to quickly read out a statement we've received from Apollo Group of Hospitals. The allegations, and the statement reads, the allegations made in the recent international media against IMCL are absolutely false, ill-informed and misleading. All the facts were shared in detail with the concerned journalist. To be clear, IMCL complies with every legal and ethical requirement for the transplant procedures, including all guidelines laid down by the government, as well as our own extensive internal processes that exceed compliance requirement. For example, IMCL requires every donor to provide Form 21 notarized by the appropriate ministry in their country. This form is a certification from the foreign government that the donor and the recipient are indeed related. The government-appointed Transplant Authorization Committee at IMCL reviews documents for each case, including the certification, and interviews the donor as well as the recipient. It further revalidates the documents with the concerned embassy of the country. The patients and the donors undergo several medical tests, including genetic testing. These and many more steps far exceed any compliance requirement for a transplant procedure and ensures that the donor and the recipient are indeed related as per applicable law. IMCL remains committed to the highest standards of ethics and to delivering on our mission to bring the best health care to all. That, of course, is the statement we received just a couple of minutes ago. Essentially, Apollo has denied all the allegations, but more than Apollo, I think it's important to have checks and balances in place, as Kartik rightly pointed out, Krishna, at the level of not just these medical institutions, hospitals, but also at government level, which in case already happens in India. So the fact that there is an established process that the report has uncovered a scam which is able to defy this process, which is able to in a sense subvert the law, is quite surprising.
Yes, and because the entire idea of having a committee is to have the checks and balances. The committee that approves the transplant is the reason why you have a mix of everybody from a doctor to an IAS officer to a health ministry representative on the committee as a check and balance for every single transplant that gets done at a particular hospital. And the question is always, one is having a law, and the second is the law being applied with the right force at the right time. So in this case, the checks and balances itself, the system itself has been subverted. So the question is, where did the subversion come from? Did it come from the hospital's end? Because at the end of the day, the hospital is the beneficiary. At the end of the day, the more the transplant that happens in a hospital, the hospital gets to benefit from that many more treatments. And correspondingly, the beneficiaries are the people on the committee.
But Krishna, just to play devil's advocate, I think the hospital is going to gain one way or another, whether the donor is related or unrelated, whether the donor is from India or from abroad.
Absolutely.
So I think hospitals stand to gain from a surgery in any case.
Yes.
But in this case, clearly it is the middlemen, the agents, the fixers who are illegally drawing a large share of that revenue pie, which is coming by way of these transplants.
And perhaps a need for a larger debate around transplantation and who can donate. I mean, of course, the government has put in place checks and balances to ensure such a thing does not happen, but it's happening anyway.
Absolutely.
There is cash for kidney, cash for, whatever possible organ one can donate.
Stricter KYC, know your customer, or KYD, know your donor. I think at a very, very fundamental level, those aspects have to be checked. Aadhaar card. Does the donor have an Aadhaar card? An Indian bank account? When was that bank account opened? When was that Aadhaar card made? Does the donor have a PAN card in India? Is the donor a part of the Jan Dhan benefits that accrue to the underprivileged section of society? So, all of these become very, very clear-cut checks and balances, perhaps in addition to the Form 21 that IMCL is talking about. And just for ample clarity, IMCL is the Indraprastha Medical Corporation Limited, which runs two of Apollo's hospitals in Delhi NCR, one of course being Apollo Sarita Vihar in South Delhi, and the other being Apollo Sector 26 Noida. So that is what IMCL really is.